If I could put on a statewide mandate, if the health department could do it, we would do it. What the legislature has made very clear is that if we put on a statewide mandate, they will take it off. They have the ability to do that. There is no 30-day waiting period. They can do it right away. And the legislature has made very clear that if we put on a mandate for kids in school to wear masks, that they will take it off. And people say, well, Mike, why don't you do that? It could be on for a couple of days or whatever. And, but the problem with that is we're going to cause, if that happens, we would cause it seems to me, a lot of confusion, and we might go backwards. We are over now, slightly over 50% of our kids in school, in public schools in the state of Ohio, are in fact under a mask order by the school. And we've made some progress. We've come a long way from the day that we actually started school this year, the days that school started. We need to go further. I believe that we will go further. We had this direct appeal today, a direct appeal from our children's hospitals who are seeing what's going on every single day with our kids. Their direct appeal to our schools, to our school boards, to our superintendents. And it was a compelling appeal. And in fact, that will be made available to anybody who wants to watch it. It lasted 1 hour. Nick Lashutka is going to make that available. I don't know whether, Nick, you have that yet ready to do, but we can tell people, we'll be able to tell not only the public, but obviously the media, and you can watch that. It was a very compelling case that they made, just as they just made a very compelling case. So this is, the legislature's made it clear to me, they will not hesitate, and they will repeal a mandate that I put on. And all that would do is cause a great deal of confusion. And then I think people would say, well, there's no mandate on, there's no requirement on, we can go back. There's really no reason to keep a mask on. So I'm afraid what would happen is we would slide backwards and we would go the wrong way instead of the right way. And so I'm counting, frankly, on the goodwill of our school boards, the goodwill of the people of the state of Ohio, when they hear the facts. And the facts have been laid out, I think, very, very clearly by our children's hospitals. I hope that I believe that when people of the state hear those facts from the children's hospital, that we're going to see more and more of our schools do what clearly is necessary, and that is to have masking in school. Doesn't have to be forever. Don't want it to be forever, but we are at a crisis right now. We are at exceedingly high numbers right now. They are not going down. And as Children's Hospital has made very, very clear, it's not just children who have COVID who are threatened. It is any child who's in an accident, any child who's got any other medical problem. The ability of these hospitals to care for these children has been really, really compromised.